What causes air, water, and waste pollution, and what are the effects? Most importantly, what are the possible solutions to tackle it? Hello and welcome. I'm your host, Dr. Musa Mtombeni. Signing with us is Tsepo Maseko, and the feeder interpreter is SABC Ndlovu. On Vital Signs, we focus on environmental health. World Earth Day is marked on the 22nd of April, and the world commemorates the day not just because we care about the natural world, but because we all live on it. Every one of us needs a healthy earth to preserve and protect our health, our families, as well as our livelihoods. The Earth Day 2022 theme is Invest in Our Planet, and the 22 World Environmental Day campaign, #OnlyOneEarth, calls for collective transformative action on a global scale to celebrate, protect, and restore our planet. The time is now to restore nature and build a healthy planet for our children and their children. Coming up on the program, producer Nompilo Kwala spoke to a young woman from Mpumalanga about her health challenges because of toxic air. We also spoke to CEO of Action for Responsible Management of our rivers and the Ministry of Forestry, Fisheries, as well as Environmental Affairs about the impact or the harmful impact of pollution on the environment, human health, as well as well-being. We'll speak to Director of Environmental Health from the National Department of Health about air, waste, and water, and waste pollution rather, and we'll speak to the medical epidemiologist at the Center for Enteric Diseases at the National Institute of Communicable Diseases about how the environment influences human health and disease. Lastly, we'll cross over to KwaZulu-Natal. Vusi Khumalo, SABC TV news reporter, will speak to the Director of Groundwork about the devastation of the floods in KZN caused by climate change. Remember, you can be part of the show by asking the guests that will have the questions that you have on your mind by simply sharing your views on what we're discussing. The number to call is 011-714-5861 or 011-714-5877. Social media is also available if you'd like to go that route. On Twitter, it's at SABC Vital Signs, or Facebook, SABC Vital Signs. We continue our discussion on the environment after the ad break. Welcome back to Vital Signs. Namhlanje sikhuluma ngezinto ezidila nge-environment and how that affects your health. Every day, people living and working in the Mpumalanga Highveld area are breathing toxic, polluted air that is harmful to their health as well as their well-being. This is a violation of their constitutional rights. We visited Musawenkosi Dlamini, a resident in Mpumalanga, Emalahleni, who shares with us her health challenges that she's currently facing because of breathing in this toxic air.
Musawenkosi Dlamini lives in Mpumalanga, Emalahleni, in an area surrounded by mines. This resulted with her being diagnosed with asthma due to the air quality in her area.
2010, that is when the diagnosis came, I'm asthmatic. Then from there, I've been taking a treatment for asthma up until it aggravated, which leaded to a renal failure, of which I have dialysis. Like Emalahleni, kube nzima for all of us ekhaya nje because kube into esingakayi-expectanga.
As a child, Musa couldn't participate in sports and other activities because of her health.
Mina eyami impilo ihlwe ngokuthi bengingakhona ukuparticipate in the ukudlala nje yabo. So it was hard for me. Sometimes then you come back home, you are wheezing, you're tired, you can't do anything. Even now, I'm in college, like I'm missing a lot.
Her health continued to deteriorate, and in 2019, she was diagnosed with kidney failure and requires dialysis 3 times a week.
They say my medical aid declined the process, the transplant, but it's appealing for that. So with dialysis, sometimes it's hard for me because like I'm still a student. I have to go to school and do dialysis, and since I can't barely, I'm cold, I'm tired. So sometimes I do miss classes due to or I can't even wake up in the morning. Good to be on dialysis. I would think I'm no choice. Dialysis. It's either dialysis or I die.
Vukani Environmental Justice Movement is a community group that deals with issues related to environmental health and human rights.
Into esiyibuka kakhulu ku-environment besibuka just ukuthi umasipala akayibuthi idodi asinamanzi kungcolile, but we didn't look ku-bigger picture le affectako or izinto ezikhosa ama-impacts around our environment. So thina into i-role esiyidlalayo emphakathini wethu is to raise ama-awarenesses in different issues like your air pollution around water and sanitation, the climate change issues.
In 2021, Vukani Environmental Justice Movement took the government to High Court over the violation of their constitutional right to clean air.
Sagcina sabona ukuthi uma sinaba nama-engagement with the local municipalities and the different stakeholders nabo bantu labo bezimayini nabo bama-qualified power station, sabona ukuthi asibi ne-solution, sabona ukuthi akube ne-third party then to take them to court ngoba vele besibona ukuthi yonke into esiyikhulumako iyatiphindza and ayibi ne-way forward.
The court declared that the air quality in the high-felt priority area is in breach of the residents' constitutional right.
Ngiyawajabulela ama-outcomes we-court, but ngifila like akekho harsh njengalobu harsh lesibufilako on the ground. And lenye into engijabulisayo kakhulu ukuthi yebo kona icase iwiniwe. But kimi asikho fully happy nokuthi sitive ukuthi siyiwinile ngaphandle kokuthi sibone i-action yokusho ukuthi ugovernment uyalibona leliphutha. Sicela nje ukuthi uminister makangenza ubulungiswa obubodwa eze emphakathini invite maybe all the responsible parties laba bekhona ku this case, angabi yedwa decide izinto or akhulume yedwa or acabange ukuthi mhlawumbe kuyaliwa, so that we can have more engagements on the issues with her.
After the break, we'll speak to Murdoch Ramathuba, the Director of Environmental Health from the National Department of Health, about air, water and waste pollution. Stay with us. Welcome back to Vital Science. I'm Dr. Musa Mthombe. Namhlanje sikhuluma ngezomvelo. In South Africa, the scarce water is of course decreasing in quality because of an increase in pollution and the destruction of river catchments caused by urbanization, deforestation, damming of rivers, destruction of wetlands, industry mining, agriculture, energy use, as well as accidental water pollution. We spoke to the CEO of Action for Responsible Management of Our Rivers, Mark McClue, and Barbara Creasy, the Minister of Forestry, Fisheries and Environmental Affairs, about the harmful impact of pollution on the environment, human health, as well as well-being. Let's listen to the interview.
In South Africa, the quality of fresh water is decreasing because of an increase in pollution.
So pollution in our rivers and in our waterways affects all of us. Water is life. Without water, we can't live.
Water pollution is caused by humans, and because of pollution, plants, animal life and human life is affected.
The biggest contribution to water pollution in this country, it sounds a bit of a cliche, but it's us. It's the citizens of the country. And whether we are a private citizen in our own house, whether it's an industrial estate or whether it's somebody who works for a government institution, then we're all accountable to what we do with our waste.
The government is reviving the Blue and Green Drop certification program that was disbanded in 2014. These programs measure drinking water quality and wastewater quality management.
So the reintroduction of the Green Drop reports by DWS is a really good thing, because now instead of hiding from the problem, we have to be able to measure it. So those reports will enable us to, or the sewage systems and the water delivery systems to be monitored officially.
Pollution and illegal dumping of waste into drains and waterways increases the events of floods.
You've seen this week or the last couple of weeks in Natal with the flooding that a lot of that is caused because of urban development and waste that's in the rivers, blocking drains, blocking systems, which increases the effects of natural rainfall and flooding. And if you're living in those communities, then sadly it can affect you directly by damage and death.
Organizations such as ARMA help because they educate communities about sustaining the environment.
ARMA is an NGO that provides a voice for water. It's the community organizations and the government organizations and the private sector working with us and working together that will actually reverse the problem.
According to the Minister of Forestry, Fisheries and Environmental Affairs, Ms. Barbara Creasy, bringing back the Blue and Green Drop program will help monitor the quality of our water.
We need to know that our water sources are fit for human consumption, and we also need to know that our water sources are not being polluted by leakages in our waste and sanitation systems. And I did indicate to you earlier that we're very concerned about the impact of poor fresh water quality on biodiversity in our aquatic systems.
Our environment sees a lot of climate change symptoms, which are bringing us into a time of environmental crisis.
South Africa, like most developing countries, is confronted by climate change. This obviously we would have seen recently resulting in the devastating floods that have happened in KwaZulu-Natal. We know that extreme weather events, whether flooding, high temperatures, drought, and of course fire are all symptoms of climate change. In terms of biodiversity loss, I think the problem that we're facing is that more and more species are going extinct. In our country, our research indicates that the greatest biodiversity loss relates to fish in our freshwater river systems. And then, as I've explained, there is the issue of environmental degradation. And here we are concerned about waste, and in particular plastic, that is ending up in our water systems and ultimately going into the oceans. And of course, we are also concerned about air quality.
According to the World Health Organization's guidelines, the air quality in South Africa is considered moderately unsafe. In South Africa, the main source of air pollution is thermal power stations and chemical factory industries, biomass burning, waste burning, and the transportation emissions. Joining us to discuss all of this, we're speaking to Mr. Murdoch Ramathuba, the Director of Environmental Health from the National Department of Health. Good day, sir. Thank you so much for joining us this morning. Mr. Ramathuba, I think you're still on mute, so if you could just unmute yourself and we'll continue our discussion. Whilst you're doing that, I think I'll get into our first question for the day, and that is, how is South Africa faring compared to the rest of the world with respect to the environmental impact on people's health?
We're not doing very well because we're still in that situation where we are generating a lot of pollution that impacts largely in our people, whether you think of water pollution in our streams, the Vaal and all this, the Olifants. You look at the air pollution in our largely high priority areas, the 3 high priority areas that we have, and as well as land in terms of the management of general solid waste. It's a challenge for the country. Although you can compare ourselves with other African countries as considered better, but we're not doing very well. We are impacting negatively to our own health by the actions that we're taking collectively as a country.
Now, This discussion of environmental health and what that has in terms of effects on human beings is one that is not unknown, that actually takes a second or a back seat compared to other big issues that are generally discussed in the UN and places such as that. So with respect to the current policies that we have in our country, what do we have that highlights the importance of individuals' health over the financial implications of putting in these policies and things such as that?
Can you come again?
So what I'm asking is, what do we currently do with respect to our policies? What do they look like with respect to addressing these health issues that are caused by environmental damage?
I think what we're doing generally, the most critical departments that has enforcement authorities over management of health and environment is the Department of Health, the Department of Forestry, Fisheries and Industry, and Environment, as well as the one of responsible for water and sanitation. There are quite a number of legislative prescripts that are being developed countrywide to improve. If you look, for example, starting with the newborn climate change as one of the recent challenges that we're having. As a collective, as government agencies, we're working together to try to come up with ways of not only mitigating the effects of climate change, but also adapting, assisting our populations to adapt. It is true that most of the focus that we have would have been especially in the health side, will be focused on the clinical response to health challenges more than the preventative side. So, when you deal with issues of environmental health, you're not talking about something that a person may easily see in some cases. So, because it's not talking to a person or to a facility, it finds itself being in the backseat. But this is the backbone of health services in the country, as well as economy in general, because the number of hours that are lost when people are, suffering from illnesses that could have been prevented by keeping the environment sound, it's massive. It's a lot of thousands of hours and a lot of money that is lost through this. And we estimated that up to 2 billion it's lost because of the environmental illnesses. Whether you're thinking of air quality or water quality or whatsoever, it's over 2 billion, which in rands, that is in US dollars, in rands it's up to 30 billion that it's lost, not only from treatment, but also from the hours that people are losing instead of working while they're going treatment. We had the clip that we had of my poor younger sister there, who is still a student and has to go through dialysis. So there are hours that she's losing of education because of the sources of these environmental pollutions or illnesses that are caused by environmental pollution.
What are some of the common sort of presentations that you'd see at a health problem level that you were getting with respect to these environmental causes causing these problems?
What are the what?
What are some of the common presentations? So what do patients come into hospitals and health facilities with after they've been exposed to all these toxins and diseases that come from either water, air, or waste pollution?
I do not necessarily work in the health facilities, but I do know that there are thousands of cases of bronchitis, asthma, heart diseases. Most of the common illnesses that are killing our people are found to be associated with this. One of the stats that we saw was that you've got over 2,000 people that are dying every year. Some dying from lung cancers, heart diseases, stroke, chronic bronchitis. You name them, and the times or the hours that are spent in hospitalization, which is over 2,000 of those hours that, and it's got nothing to do with age. It's both young people and the older. But of course, the younger children are most affected, and women, especially in rural areas, because they are the ones that spend most of the time apart from the pollution that everybody is exposed to outside, they spend most of the time in the kitchens where we are using biomass fuel, burning of coal and all those things, spending most of the time in the back of their parents or whoever is taking care of them in that environment which is highly polluted. So they find themselves being the most vulnerable or the most at risk than the adults.
Now, climate change is one of the big topics that has been around for many years, but I think over the past 5 or so years, we're seeing a lot more evidence of actual damage. I mean, the KZN floods, for instance, is one of the things that comes to mind that highlights how important looking after our environment is. So why is it so important to look out and look after the environment to benefit our health?
I think the first thing that one needs to know is that when you look at climate change, or maybe before one can even go into looking into climate change, it's critical to understand that the atmosphere, that is where we're breathing from. It's the Earth's largest single shared source, which we are using, all of us are using globally, which protect and support life through the absorption of dangerous ultraviolet solar radiation, as warming of the surface, as well as the temperature regulation in general. And this atmosphere, because it's open for everyone, the polluter in the east can impact on the non-polluter in the west if by all the CFCs that they produce or the gases that they produce that are not friendly to the ozone or to the atmosphere, if you want to make it a bit simple. So obviously, impact on that, it's one of the aftermath of that is the climate change impacts that we're seeing, the floods that we're seeing, the increase in temperatures that makes the environment or the areas that previously were not endemic to malaria, for instance, becoming endemic to malaria because the environment now becomes conducive for the Anopheles mosquitoes that requires a particular climatic conditions to survive. But then that ends up opening up to other areas. So it's very critical for us to protect our environment, both by preventing the pollution caused by the burning of fuels and plastics that we burn on a regular basis. I've seen in one of the municipality where we visited, where we saw that a person that is given the responsibility to monitor the services or the activities in the site is the one that is starting fire to burn the waste instead of the municipality bearing that weight. So those are some of the things that we pick and we try to correct with those municipalities that are involved in those aspects. But in general, climate change is a new challenge that we're having globally, and it's impacting very negatively in most areas. It's actually enhances the challenges that we're having with the general pollution. But we're working together with the Department of Forestry and Fisheries as the lead agent as far as issues of climate change is concerned. And as a Department of Health, we have recently concluded a project on the risk and the vulnerability assessment, where we try to seek to identify the population's areas that are vulnerable to climate change impacts. That includes those members of our communities that are residing in the less than 50-year flood zone, where if it rains like it did in KZN now, the likelihood of them being flooded, it's very, very high. So those are some of the things that we're dealing with. And we have and this risk and vulnerability assessment process, it's part of the National Climate Change and Health Adaptation Plan, which we are currently reviewing, which is meant to assist the country to adapt from the health point of view, to adapt to climate change, because climate change is here. Preventing it is no longer a much of a priority because it's here. It's more about mitigating and adapting to the conditions so that we are not worse off as such.
What can individuals do to lessen their footprint on polluting the environment or making these resources become constrained and things such as that? What can the one individual do to improve the environment?
I think the first thing that we need to do is to start from the shops where we are procuring our products that we need to use at home. I think the country has played a role in general in trying to reduce the use of plastic by making us pay for plastics. So 50% of people that are shopping that could have gone home with plastics opt to come with bags instead of plastics to make sure that they don't pay. And in that way, it's assisting in reducing the pollution that may come out of the plastics that we might have used to contain our foodstuffs or whatsoever that we are buying. Avoiding the use of fossil fuels, which is not option to most of our people.
No. Because
our people are forced to use fossil fuel because they cannot afford any other better source of energy. You find that in the townships or in the areas where people have been given RDP houses with electricity, while being indigent, they still feel that they still need to use fossil fuel to subsidize the electricity that they might be losing while they are cooking or generating heat or energy in there. One of the things that we have seen is that in winter it sort of gets worse because of the temperatures getting lower, and it becomes dry such that it's easy for people to just throw a matchstick, and then you've got a field fire that contribute heavily on pollution. But by and large is to make sure that whatever we generate as waste, let's try to reuse as much as possible. We are reusing the plastics, most of us recently. So let's try to enhance that process of reusing the products that we are using instead of generating and throwing into the disposal site. While the local authorities that are responsible for final disposal also have a role to ensure that the proper waste disposal systems are being implemented and monitored throughout the process.
Well, thank you so much for answering our questions this morning and really giving us an outline of what the government is doing with respect to the environment and environmental health. That's Mr. Murdoch Ramatuba, the Director of Environmental Health from the National Department of Health. Remember, you can be part of the show by asking the guests that we have the questions that you have on your mind. Simply share your views with us. The number to call is 011-714-5861 or 011-714-5877. Tell us what's going on in your neighborhood. Do they collect the bins? Do you have a designated area where you can take your waste and the municipality takes that and goes to destroy it at another facility? Are these services available to you? Well, stick around and of course you'll find out, and we want to know what you're thinking. This is Vital Signs. We'll see you after this. Welcome back to Vital Signs. Now, climate change is already affecting water access for people around the world, causing more severe droughts, floods, and the spread of diseases. We speak now to Dr. Linda Erasmus, a medical epidemiologist at the Center for Enteric Diseases at the National Institute of Communicable Diseases. Good day, Doc. Thank you so much for joining us today.
Thanks very much for inviting me.
Good. So a lot of the time we hear this term communicable diseases. What does it actually mean for the everyday man? What does communicable diseases mean?
So communicable diseases are, so chronic diseases or non-communicable diseases are things like sugar disease, diabetes, hypertension, heart disease, whereas communicable diseases have a pathogen, so a virus or a bacteria or a parasite, and can be transmitted between people or between animals and people, which is called a zoonosis, or sometimes involves a vector like malaria, where the disease is transmitted through the bite of an arthropod.
So the big thing here I think we can take away is that these are diseases that are transmitted from one person to the other. So with this, how does the environment then play along? How do we get diseases from the environment?
So in many, many different ways, and the relationships between say, climate or environment and infection is very complicated. And it's also quite difficult to measure impact of things like climate change on infection or infectious diseases. But there are many different ways that it can impact. So if you look at the natural environment, things like your water source, where you're getting your water from, things like climate and weather, things, floods, for example, as we've had in KZN at the moment, and droughts can have huge impacts on disease. And there are various reasons for that. So there are direct reasons. So you may have, for example, floods and have trauma. And when you get breaches in the skin from trauma, you may get increased infection with that. You get disruption to your sewage and your water supplies. So you may get sewage contamination of your water, and that in turn can lead to a host of infections, usually diarrheal infections, cholera, typhoid or enteric fever, as it's called, and various other bacterial and viral infections. But over and above that, when you have climate change and when you have extreme weather conditions, for example, then you can get various impacts. So one of the most immediate is you may get displacement of people. So you need to find shelters for those people. There's crowding, and crowding in itself makes people vulnerable to transmission of disease, for example, respiratory diseases, the viruses we see, flu, colds, but even pneumonias. So all of those can impact. And also, obviously, in those kind of conditions, your sanitation, your water provision can be challenging. But also, if you look broader, then there may be impacts on economy, and impacts on economy can also lead to conflict situations. Conflict situations can lead to mass migration, and then you get disruption of healthcare services, disruption of things like vaccination, and people possibly transmitting diseases or transporting diseases to other areas. So they're all very complex interactions between social and environment and economic factors and disease.
So a lot or a large number of people find themselves living in informal settlements, and these settlements are generally, environments where people settle near water sources so they can collect this water, boil it to drink and to use, but also poor sanitation is a big thing in these informal settlements. So I know you've mentioned some of them, but what are the big things to take away from poor sanitation in a statement or in this environment that we find ourselves in?
So many of particularly the diarrheal diseases are caused by contamination of water with feces or poop from people.
Okay.
So when people get a disease like cholera or typhoid, which is now called enteric fever, they will shed those bacteria that can cause disease in their feces. And that can contaminate food if they're preparing food in the home, or water sources, which can then transmit that disease to other people. And I think the important things to remember, and many of our population live in quite challenging circumstances, but if you do think your water sources are unsafe, or you have a particular crisis in your area, then as you mentioned, things like boiling water can clean water for you, purify the water. And also something like just household bleach can also be used to purify water. And we always emphasize the importance of hand hygiene. So not only washing your hands, but washing your hands with soap and washing them properly. And particularly after you've been to the toilet, after you've changed nappies on a child, if you're caring for somebody sick, before you prepare food in the home, before you eat, after you eat, that hand hygiene is really, really important. And then food safety messages, cooking your food properly, trying to keep raw things separate, raw meat and raw vegetables separate, but most importantly, storing it safely and cooking it thoroughly. So those are basic things within the community that we can try and adhere to. And they protect from a lot of diseases, obviously from enteric diseases, diarrheal diseases, but also good for other diseases, the hand hygiene.
So an important thing you just brought up is this issue of community, where a lot of established informal settlements or communities that have to use these raw natural resources to get their daily living out of are already established. But we find ourselves in a situation like we have in KZN, where a natural disaster of sorts or climate change sequelae come from it. And we find ourselves in a situation now where these things have now changed the environment, that what was deemed as normal, where people could just open a tap and get water and now can't anymore because of infrastructure being damaged. So what changes do these people, or do they experience the same things as those in informal settlements that now have to deal with when a climate change issue such as a flooding or destruction of infrastructure come along?
There are enormous issues that they need to deal with. So the most critical thing is in the acute phases. Obviously, you can get people drowning, people being subject to trauma, fractures. The most important thing is to get people into a shelter, and then the provision of clean water to those people. So that may need to be brought in by tanks, tanks of water, to try and organize some kind of sanitation system for those people, and to, again, enable them to hand hygiene, to wash their hands, to keep a level of hygiene, also to try and prepare food safely, make sure they get adequate food. And again, we've said that those situations are crowded, which lends itself to respiratory diseases being transmitted. And, all of those things are really fundamental. And one of the long-term effects of all of these things, obviously, is mental health, where people have post-traumatic stress disorder, they've lost family members, they've been injured, their home is gone, anxiety. So there are a range of things. And I think one of the really important things as well in these circumstances is that people who have chronic diseases like diabetes or hypertension or heart disease often lose their medication. So, you get exacerbations of that, and it's not always easy to access healthcare. The hospital might have been, in one of those flood areas, and records may have been lost. So, the ramifications of the disruption are huge, and all of them have implications for human health.
All right, Dr. Rasmus, we've got a caller. This is Pumani from the Eastern Cape. Pumani, good morning.
Good morning, sir. How are you?
We're very well, thank you. What's your comment, sir?
Yes, man, I'm worried in our township here in Sada. Hello? Can you hear
we're
me?
Listening. Yeah.
Yeah, I'm staying at Sada in Whittlesea at Communicable locality, local government.
Okay.
We've got a problem. It's been a year or so. The rubbish is not taken all the time. So the baby nappies are lying all around our streets, and it's hectic around us. And we are fearing that we'll get these health hazards. Yes, I wanted to notify you about that thing.
All right, thank you about that. I think this highlights an important thing that, a lot of the time we'll speak to waste pollution, but no one really understands what that means. Water pollution, we kind of get. There's someone throwing something into the river and it no longer affects them, but downstream people are affected. Air pollution is, this concept that a lot of people don't necessarily see until they get sick because, it's the air I breathe. The waste pollution is an important one. How does it affect people's health, Doc?
So again, in a variety of ways. So you may have infections that are able to grow in those kind of circumstances, but also things like you may get rats or other mice or rats or animals that can also transmit disease, increasing in number. So all of those things, contamination of water supplies and all of that. So in various ways, yes, it is definitely, as you say, a health issue that we often neglect. We talk about the pollution in the water and we forget about the waste.
Thank you so much, Dr. Erasmus, for having this chat with us today. I think an important one to have where people need to understand the importance of keeping their environments clean. Sometimes, what you do at your one spot along the river actually affects people downstream and may have an effect on them later on in life. Very important discussion that we're having today, speaking about the environmental impact of what it actually looks like on your health. This is a discussion we'll continue to have after this ad break. Welcome back to Vital Signs. Now, the recent devastating floods in KwaZulu-Natal province, which have claimed over 435 lives so far, are one of the most visible and deadly signs of climate change in the country. The devastating scenes of the floods show us how healthcare systems rely on infrastructure and roads in times of needs. Water infrastructure and roads were severely damaged, forcing community members to scrounge for anything that they could get their hands on. We cross live now to Vusi Khumalo, SABC TV news reporter at a community hall in Dussenhoek area in KwaZulu-Natal. He'll speak to Bobby Peak, the director from Groundwork. And let's cross on over to them. Mr. Khumalo.
Yebo baba. Sawona Mr. Toma.
Yebo baba. We can continue and
yes,
please have that discussion with
yes,
Mr.
indeed. You are coming to...
Continue, sir.
Yes. We are going to talk to the environmental justice activist, Mr. Bobby Peak, who's one of the people working on pollution. As you know, that the country has been engulfed by the floods, of which pollution is one of those things. As you heard, the president said that there will be increasing funding when it comes to the climate change matters as the country is battling the floods and other environmental events taking place in the country. But not only here in South Africa, we know that a number of countries are also battling when it comes to climate change matters. But with me are some of the people who have come to bury their loved ones here at Ichelimnyama, west of Durban, which is one of the areas that was also hardest hit with more than 400 deaths as a result of the floods that struck KwaZulu-Natal just about 3 weeks ago. As Nom Mhlengubani is showing you, these are the community members of Ichelimnyama who are here to bury their loved ones. Let us now shift the focus now to the all things environment, justice, when it comes to the matters of the floods in KwaZulu-Natal having left a trail of destruction. The amount of the damage, according to the preliminary report so far, is about 17 billion. So you can see the amount of the extent of the damage in KwaZulu-Natal, with Durban being the hardest hit. Areas such as Inanda and Uzuma, Ichelimnyama, where we are at Dussenhoek, is one of those areas with a number of people who died as a result of the floods incidents that took place in the areas of eThekwini. With me is Mr. Peak, who's going to tell us about some of the things that he's working on when it comes to the pollution. As the groundwork, what sort of work that you normally do, sir?
So, Vusi, thanks for having me on. And it's really a sad day that on Freedom Day we have to bury somebody because of the flooding caused by greenhouse gas emissions and caused by climate change. And the president has said that these floods are because of climate change, and we know that that's going to happen more regularly in the time to come. So Groundwork works on climate change and energy access for poor people. We work on waste, and we know that waste is a big issue, especially with plastics. And Groundwork has just been instrumental in working on the plastics treaty that was signed in Kenya recently. We also work on environmental health, helping government to be able to provide better health services to people. And we work on coal and mining and how coal impacts mining affected communities around the country with air pollution, with dust pollution. And so that's the work we do. And finally, just up the road from us today, on Freedom Day, Groundwork has got 20 activists from around the country meeting together for 3 weeks to learn how to better organize for climate and environmental justice.
Yes. In terms of the international standards, how do we fare in terms of pollution control and policy?
So South Africa has some of the best policy, and our constitution, section 24, is very progressive. It says people have the right to an environment that's not harmful to one's health and well-being. It's one of the strongest in the world, but we just do not implement. We just do not deliver. And as a result of that, we had to take the president and the Minister of Environment to court because they would not deal with air pollution in the country. So in terms of South Africa, our air pollution guidelines, our standards and our water standards, these standards are not being met, and these standards have been broken, and yet there's no action taken by government. So sadly, we don't fare well.
Okay, thanks a lot, thanks a lot, sir, for your time.
Thank you very much.
Okay, now let me talk to, with about 2 minutes left, let's talk to the local residents who've been hit very hard by the floods. Let me start kuwena mama. Ibo igama nesibongo nje kafushane mama ukuthi wena wakhahlameze kangakanani. Siyazi kade ungcwaba amalunga awu3 or amalunga awu4 omndeni. Awushela ukuthi nina mhlawumbe isimo ngokwamanzi yoba nihlala la niwathathaphi niwakhaphi. Lokho nikhahlameza ngane kafushane nje.
Amanzi siwathatha kwe-stand pipe ngaphandle emgaqweni. Siyacela abantwana basikhelele amanzi esiwadingayo basikheleleke. Omakhelwane abanye bayabasa la basibekela amanzi. Amanye amanzi siwabekelwa ngaphakathi la ihall la kade siwekhiwa abantwana abasikhelele nawo ase-toilet ngoba awekho amanzi ase-toilet ilokho nje.
Okay, wena wakhahlameza kangakanani sabone ukuthi umama kade echaza ukuthi isimo samanzi siyinkinga kakhulu la endaweni.
Siyinkinga kakhulu, siyacela usizo, asinamanzi. Uma ufuna ukuya e-toilet awukwazi. Kunzima nje futhi ngicela nosizo. Ingane yami ayikatholakali kusukela ngalezi zikhukhula. Ingane la sihlala khona noma uzawukho ngicela usizo ukuthi mhlambe kuzanywe indlela ukuthi kuyogunjwa lapha mhlambe uvaleke phansi komhlabathi. Ngiyacela ningisize kakhulu.
Okay, siyabonga kakhulu. As we're traveling here, we could see that the power hasn't been restored, and the women here are saying that there's no water as well in this area of Elimyama. They're saying that they are sending their kids to fetch water from here at Dazinok at Elimyama. They are sending their kids to fetch water from a communal standpipes so that they can be able to flush the toilet. There are 50 of them staying here inside. So these are the victims of the floods that took place here in the province of KwaZulu-Natal. With that said, it's back to you for now, Musa. Dr. Musa.
Thank you so much, Mr. Kumalo, for covering that interview with us. And a very big and important points being highlighted at that. Seeing what the disaster has done, seeing what the flood and what the environment, what climate change and all those sort of things that you've heard about, that we speak about on a daily, and how important it is to note these things, that preventing them is no longer a thing that we can do, that they are here. We need to now think of ways, creative solutions that we can come up with to make sure that these things do not become disasters once again, that we find ourselves in situations where we're not finding, landslides and families being lost and people having to bury 4 or 5 loved ones in a day because of a natural disaster such as that. And not only that, but having this issue compounded by having to live in an area that doesn't have running water anymore, living in a community hall where the risk of getting those respiratory infections and maybe even getting infections just from, being around other people actually increases just because of a natural disaster that has happened before. Climate change is here. We need to think of ways to combat that. We've got the policies in place. We just need to enforce them better. From us here at the Vital Signs team, thank you so much for joining us over the past hour, and we hope that we've brought this attention of environmental health back into focus. From here, me, Dr. Musa Mtombeni, will see you again next time.